All right, well, I've got 1 o'clock Eastern time, so we will get started. Thank you all for coming today. We will be focusing on mental health barriers in military spouses, and we do hope to have a really good discussion. So please, if you're comfortable with unmuting and speaking or using the chat, we'd love to hear from you. It looks like we'll probably be a pretty small group. So hopefully we have good participation anyways. So my name is Kellie Pytel. I am an assistant research professor at the Clearinghouse for Military Family Readiness at Penn State University. And then I'm also a part-time teaching instructor at Lockhaven University. And with me, I have a student from Lockhaven.
Hi, everyone. My name is Kyra Hughes. I am a student, as Dr. Pytel has just mentioned, for the Clinical Mental Health Counseling program. My background includes a couple years in crisis counseling. That's still my current role right now. And I also have a little bit of a background in corrections as a drug and alcohol counselor.
Great. So if we move forward with our presentation, our objectives for today, we want you as participants to understand barriers in mental health treatment that exist for military spouses. We also want to be able to identify areas of growth and how counselors can best serve military spouses. And we want to engage in a discussion about different innovative and creative strategies that can be used to address the barriers that we've identified and discussed for military spouses, particularly with regards to mental health treatment. We know that you are all probably coming from a very different background in terms of counseling and the services that you provide. So it would be great to hear some of the ideas that you have once we talk about barriers, things that would work well, you know, instead of the traditional theories that we're used to, CBT, psychodynamic theory, things like that. So before we get started, we want to know, are you military connected? So are you military connected? That could be family member, it could be very direct, like family member, or it could be a little bit more indirect, like perhaps you work with this group at the VA or in the community. Again, please feel free to use the chat to chime in or unmute. We'd love to hear from you.
Yes, ma'am. This is Sandy, and I'm active duty, actually.
Great. Well, thanks for joining us, Sandy. It'll be great to hear your perspective from active duty. What branch are you associated with?
Navy.
Navy. Monica, mom of active duty Army. Great. Another great perspective, and one that isn't often noted in the literature as much. Parents of those who are serving. As we're waiting for others to chime in, so I am connected in a lot of ways to the military. My husband, he served in the Navy. So I was a military significant other, and then I was a military spouse. So I saw both of those perspectives and how different they were being included in the culture per se. And then now I work with the military. So I've done a lot of research helping to improve programs that exist. So some of the projects I've worked on looked at suicide prevention and intervention strategies. And now I'm looking at the family advocacy program and working to improve a staffing model so that those who are experiencing issues in the family, domestic violence and abuse, child abuse, neglect, that program is better staffed to address those needs. Catherine, I see you chimed in, military spouse, mom, sibling, and former brat. A lot with the Air Force. Thanks for sharing that.
And I can kind of relate to with Dr. Pytel. So I was also a military, well, still am military spouse and military significant other there briefly, but been a military spouse now for about 11 years. My husband's been in the Army now for almost 17 years, I think. So that's kind of where my background comes from.
Great, and we've got a lot of branches represented. Anyone with the Marines? No. Well, thank you guys for sharing. And again, please, please, please chime in from your perspective as we go through this presentation.
So kind of looking here at military culture as a whole, and with the chain of command, military language, and things like that. So military was really the culture shapes thinking, speaking, acting, and appearance for the length of service, and even for a great time afterwards for the service members and their families. So looking at talking about working with the unique populations of what military culture is. So kind of the stages of culture, looking at basic training, military commitment, separation, and things like that. So if anybody wants to share any kind of experience they had within those stages or anything that's kind of relevant to military culture, you can put it in the chat box or unmute yourself, whatever you feel comfortable with.
Yeah, we like to have this slide in here because some people say, oh, I don't realize that military is a culture. Or what do you mean military is a culture? But it seems like in our audience, based on our initial question, a lot of you are already military connected. So we don't want to spend too much time telling you about a culture that you are aware of. So our focus here is making the point that at any stage of culture, providers, us as counselors, can step in and support. And, you know, active duty versus when, you know, the family transitioned to the veteran status, very different types of support needed based on what the military is providing. So yeah, anyone want to speak to their experience in military culture? What's different about it in comparison to civilian culture? I know for me, I still struggle with military language and all of the acronyms that are used. Still to this day in research with partners, you know, we're on a partner call and it's like, what is that new acronym that you're using? Who are you talking about? So I usually make a note. Sometimes I ask and I'm just saying like, hey, like, you know, you just use that acronym. Would you mind like explaining what that is? And they will. And it's like, oh, duh. Or like sometimes I'm worried about asking about too many. So I just make a note and then I try to look it up later or ask a colleague, and it's just a little bit different. So Sandy said high standards of accountability can be difficult for non-military to understand. Yes, absolutely. And Monica, yes, please do share.
Thank you. So I decided to go back to school to get my master's in marriage and family therapy as an art therapist when my son was accepted to West Point. And we have a military family background, but I had no clue that my son was even considering this, and he attended. And so I did my research on supporting moms of the students at West Point and gained a lot of knowledge about the anxiety of, you know, what our futures are like or could be like for our children. And so now, you know, he's a 2017 grad and he's a captain and he is in a relationship that's leading to marriage. And so now I have a different perspective of how do I support or do I support my son and his new bride, right? Because she has no military background as well. So it's quite interesting. And you're hitting on some topics that are, you know, very sensitive to just myself, but also as a therapist, I have volunteered at the local veterans to support dementia and hospitalized veterans with art therapy, and I'm just gaining an immense appreciation for the culture and the people who support our military, active and retired. So thank you for this presentation. Nothing more else to share. Just wanted to share, my perspective of who I am and why I purposely have been focused on this community, and mainly because of, suicide prevention. We just lost a member this last week of our class. And so it's hit hard, everything that happens. So thank you for the opportunity to speak.
Well, thank you for sharing, Monica, and all that you are doing. So not only to support your son and the individuals that he's with, but then it sounds like you found ways to be involved in numerous ways. And art therapy is a creative technique that I do hope that you talk about later, what you're doing with your clients, how you're using it, how you could see that transitioning to, today we're talking about military spouses in particular, but it would be great. We're looking for those different ideas of, could this be a way that we get more individuals into support services that seem a little less threatening given some of the barriers that are out there?
Yeah, so as far as the art therapy side of it, I'm real passionate about that because, and I've just launched my private practice. My credo is reveal to heal and trust the process. And the reason being is that words cannot come out, especially with our military culture, that they don't speak. And so the creative process with a trained art therapist professional is that we process what emerged in that creative expression. And I have to say, as a witness, I get goosies every time the realization from my client when they'll say something like, how did you see that? How did you get that? And it's an opportunity just to allow people to be authentic when they can't. The culture has told them to not speak up. And so now they are. And so yesterday I had a conversation with my son, and his whole thing about me going back to school when he started school was, Mom, why are you doing this? You're in your 50s. And it's like, well, thank you for your concern, but I don't think I need your permission. And here's my focus. And I told him about the suicide rate. And he said, oh, I approve of you going back to school. And I had to chuckle when I remembered that yesterday. And I told him, and he goes, yeah. And now living in, I live in California, and he says, and now, Mom, you can go and support through telehealth the active duty that are down in Monterey. And so it perked up my interest as how he is committed to what my purpose is in supporting. So art therapy is a reveal to heal. And, I do a lot of interventions and assessments and ongoing practices with my clients that is very storytelling. It's a cognitive behavioral therapy approach, and yet it's a narrative approach of what they're going through, whether it's trauma or acceptance or just the uniqueness of who they are. So it's leading them back to the authenticity, right? So, I can talk forever, but it's not about this. I just wanted to just share that there is an expressive way besides just the traditional talk psychotherapy. And there are creative expression classes that people can take. And it's just, I feel it's an easier way for acceptance of what a therapeutic relationship could potentially, occur between the family members and the actual military members. So thank you for giving me that opportunity.
Yes, and I love so much of what you said, being able to have someone tell their story in different ways. And when we look at the military mission here on this slide, it's so different for every individual. It could be a squadron of, I don't know, we'll say 50 individuals that go through what we would say the same mission, but that experience is so different to each person in that squadron. And so as counselors, we really need to be able to recognize how these components play in. What was their experience like with chain of command? Obviously, they're the ones that are dictating a lot of what they do. So if we're looking at active duty or even after service, they were constantly being told what to do and receiving orders from someone higher than them. So when we're looking at transitions, it's very hard. I've worked with a lot of student veterans, and they're like, well, now I have choices. I can decide what I want to do. I can decide if I want to go to class. Like, this feels weird to me. Like, can you tell me what to do? Because I have so many options right now. But being able to build rapport, knowing military language. I was very honest. I'm not going to know every acronym, and that's okay. But knowing that there is a language, and being able to speak it to some extent, or be honest and say, this is where my perspective, I'm coming from a spouse view, and I don't know all of this. But then too, knowing that every military mission is unique, and in addition to the laws that we have to abide by, our state laws, federal, the military has their own laws. And so when you're working with individuals, realizing what that could mean to their experience, or, how that dictates their way of life. I always use the example of like driving really carefully on military bases, because there's always that fear of, if I get a speeding ticket on base, that's a whole different story than getting a speeding ticket out in the community. But if you did around a military base, it's likely that it would go back to your commanding officer and they would find out about it. But the same thing too, if you have children or you're a spouse and you do something wrong, it's likely to reflect very negatively on the service member. So that's just something when we're thinking of military culture and civilian culture. Like, my husband's current employer wouldn't care if I had a speeding ticket, but in the military, it would have been a very serious thing. Like, you need to control your wife, and she needs to realize that there's laws and rules on base. So moving forward a little bit, just talking about military culture and the perspective of the spouse. So how is this different?
Yeah, and like we mentioned too, military spouses are said to serve too, because they're also living in that military culture and facing those unique stressors like Dr. Pytel had just mentioned.
Yeah, and so if you look at some things that the spouses often experience, so they are two potentially living on military base or an installation. They are required to use language and follow laws. They relocate just as often, and that often means meeting with a variety of different people and seeing many places. So when we're thinking of the transition to veteran status, I've talked to a lot of spouses, and they almost get this feeling of like claustrophobia, or like, now I'm stuck in this place. I'm stuck with, a few people around me, and I miss moving every 3 years and meeting new people and living in different communities and things like that. So when we're looking at this list, these are all, some of them are challenges or stressors, but some of these are also a lot of benefits that the military provides. I think in the literature and in our field, we sometimes focus on the deficits or all the negative things that can occur, but there are a lot of positive things, like given the opportunity to move around and see different places of the world, having access to a variety of support services in active duty while serving, reliable finances, reliable health care. But though there's those really good things, there are some really scary things too, like fear of risk and harm to the service member. So that's another component of this culture that we want to make sure when we're working with an individual and thinking of their experience. Someone might come in and say, I love the military, I love that life, everything was very positive. However, someone else might come in and say, this is horrible. I really want to leave the military for all of these reasons. I don't feel supported by command or the community. And, I'm struggling in all of these different areas. So focusing on this perspective, consider how much could be brought to counseling and all the different ways that it could go. Anything to add, Kyra?
Just touching base too, like on, you mentioned, I think the unpredictable work hours, right? So it's not like an 9 to 5 Monday through Friday type thing, and depending on the status, active duty or National Guard or things like that, that's going to vary too as well. So looking at the military stigma here, so we have that the training teaches the warrior mentality, and that kind of results into asking help as a sign of weakness, right? So with the military culture, it's all about, loyalty and being strong, kind of having those views of being anything below that is not, could face negative consequences. There's also repercussions of fear of being discharged too, if they don't feel that you are fit for your position.
Yeah, and when we think of military stigma, we really want to understand what this means, how it poses a barrier to the service member, and then also how that plays out to military spouses. So looking at service member barriers, there's a lot in the literature that looks at both access or I guess just looking at external barriers and internal barriers, which is how we grouped it here. So external barriers, availability of resources, and what we mean by that, if we're looking at mental health, is location of where services are being offered, time constraints, again, going back to those working hours. Is there time in the day to attend counseling if needed? And then wait times as well. So in the community, I've worked with a lot of providers in the community, and they've said, we have huge wait lists, and that is an issue, particularly if individuals want to use TRICARE or if they want it to be family counseling. There's a lot of different factors at play that make this time to get into counseling very long. Competency of care. So we do, when we're looking at mental health professionals, we've got a ton of social workers and psychologists working with this group, but it is very, very hard for counselors to access. With advocacy efforts, it's been getting a little bit better. So the DoD and the VA are both a little more open to having professional counselors, licensed professional counselors, marriage and family, but you still hear the barriers that exist in terms of, well, I'm looking for a provider that can work with me, but I'm frustrated because no one understands the military or no one's connected to the military. So really increasing our providers out there equipped to work with this group is important. And knowing that mental health counseling programs at the master's level need to do a better job of recognizing that this is a diverse group, and we need to be better training master level clinicians to see this as a potential group to work with. Mm-hmm. Support is another thing, getting the time off. Also, again, insurance coverage, if they're wanting to use insurance or not, that could be an issue depending on where they go, on base or off base. Internal barriers, perception of services. So that ties into our last slide as well, and stigma of help. There's a lot of fear about going to receive help because of this repercussion for their career. So I know one person that my husband was pretty close to, he was a pilot. He was experiencing a lot of anxiety in his role. And he was worried about reaching out for help because he was worried that they wouldn't let him fly with anxiety, right? Consider that. Someone flying a plane with, X number of people in the back with anxiety. And he realized that was his main job. What else are they going to have him do? So there was a lot of fear of, should I go get help and talk about the anxiety that I'm experiencing, how it's, leading to difficulty sleeping and things like that? Or is it better for me to just keep quiet because I've got a wife and 3 kids that are counting on my salary? And this is ultimately the job that I love and I want to continue doing. So there's a lot of literature looking at external and internal barriers for the service members. We can infer some things about spouses, but really this is a line of research that is lacking. So when we look at external, again, we can kind of say availability of resources because some literature indicates location could be a barrier. Again, time constraints, wait times. Sometimes services aren't necessarily extended to dependents. These are all things that, if you're reading news sources or websites, they seem to indicate. But again, not a lot of evidence-based research looking to survey or interview military spouses on what do you feel are barriers to care. Awareness of resources. So the Department of Defense often sends out surveys across the branches asking spouses, it's almost like a community survey or feedback on are you aware of resources on this base? And a lot of times they get responses of, I'm unaware of this resource, or I'd like to know more about this. And so that's definitely seems to be a barrier. If you don't know that the Family Readiness Center exists and helps you around times of deployment, then you're definitely missing out on that. Competency of care, we mentioned before. Again, do you know what the stressors of what spouses go through because you understand what the military culture is? And that could mean that the mission comes first and the family comes second. And that's something that the spouse is potentially in counseling for, not only for active duty, but then when reintegrating, that sort of switches. I've spoken to a lot of spouses who have said, it's my turn now. And there's sort of this resentment of, well, I had to follow my service member all over. I couldn't really have a career. And now it's my turn because we've gotten out of the military. And so if a counselor is working with that individual, it may be very difficult to understand, well, what do you mean you couldn't be a teacher? Could you not find a job as a teacher? But it's okay, we're moving every 2 years. There's issues with licensure reciprocity when we're looking at our counseling roles and counseling the military. If you can do that spousal hire on base and be lucky enough to keep getting a job, but often there's these big gaps in employment and things for military spouses, which is another stressor on the family finances. Support we talked about before, but really looking at internal barriers, there's a lot of this stigma, perception, fear, mainly on behalf of the service member. So, I don't want it to reflect badly that our family is going to counseling and so we don't, or our kids are acting out and they need services, but I'm worried about taking them for services because then it looks like we have poorly behaved children, things like that. When reintegrating out into the community, these internal barriers have been so ingrained that then it's I don't know how to ask for help, or I don't know where to go for help. Because again, it's counseling doesn't come to the forefront of their mind. It's not something that they've been utilizing all that time. Or again, perhaps there's more of these external barriers at play that just, they feel well, we'll try to find support elsewhere before we go for mental health counseling, so to speak. So not only are there barriers on behalf of the client, but there's also counselor challenges. So I talked a little bit before about history. So when we're looking at those who serve the military, in our history of mental health professionals, a lot of psychology and social work are in these roles. And so for counselors, it can be very difficult to access this group. It can be very difficult to access in terms of working, if you want to work active duty, if you want to work in the VA, if you even want to work in the community, because you're not necessarily getting the referral sources on base, or you have a lot to prove to advertise yourself as one that can work with this group. Access, that again ties into like, where are these individuals? How do I find them? So if you're working in outpatient centers, it's a lot more difficult to find the military spouses, dependents, active or not active duty, but veterans, and say, I want to work with you. Training, if you've gone through master's level training, it's not likely that you are competent to work with the military. Lockhaven University, where we are, we actually have a unique military track for students. And so they take 2 elective courses focusing on working with 1 active duty, and then 2 more on the other side, reintegration within civilian society. But for a lot of students, they feel like that is good foundational information, but then they need to have more training in terms of the practicum and internship experiences. And that can be very difficult to get. Again, reaching out to the VA, reaching out to different clinics, they can be turned away because, the VA, for example, is often looking for doctoral level psychologists, or they're looking for, a social worker because of these reasons. So there's a lot that when it comes to training, it's difficult for individuals to get the foundational training to say, I am competent to work with this group. Licensure type, that definitely ties into the other things we've been talking about in applying to different jobs. Some individuals are more aware of the counselor identity than others. So if they're applying to a general position, it's usually social, like we are looking for a social worker, psychologist, and others. And somehow we fall into others. But depending on who is looking to hire or who's doing the interview, there's a lot to be said about, this is my identity as the counselor. These are how I meet all of the things that you're looking for. I am able to diagnose, I am able to treat, and then finding support for saying that they can do those things. I've been turned away, and I've had other students been turned away from positions because they think counselors can't diagnose. Or, it's like, okay, like, where is that coming from? Another comment was like, well, we don't think that you're strong in case management. Okay, but like, can you explain that a little bit more? Because we do a lot to collaborate with others and like find resources and things like that. So awareness, being aware of where people are, having clients be aware of us and what we can do, and then just developing that therapeutic relationship, being able to say, I hear you, I'm here for you, I understand the military, and being able to work through some of those internal and external barriers. Like, are you going to tell someone that I'm seeing you? Confidentiality concerns, being really clear in the informed consent about your role as professional counselor in helping them. And then being honest too about, this is where I am in terms of my military perspective or experience. And, you know, I'm going to look through your lens to better help you rather than say, you know, well, as a military spouse, it wasn't like that. No, like, it's good to share. I'm usually viewing this culture from this lens because that was my experience. However, I'm going to understand your lens as a mom, as, you know, a significant other who is experiencing a little bit more barriers because the military doesn't always see you as one. Sandy, I see you have a question.
It's not so much a question, just I guess a statement. So I have actually held every role, I guess you can imagine. I was a dependent for 4 years of a service member, a dual military service member. My husband separated, so I am the sole service member with a dependent, and my son is enlisting, so also a mother. And I can tell you each role comes with its individual hardships. I don't know what the word is, but
Right.
none of them are similar at all. The worries and the stresses are all different for each role, and I know each role like very, very well. I've lived them all. And even with my active duty experience, it doesn't, I don't know, like even though I know better, that worry and that fear for my son doesn't go away. Does that make sense?
Yes, yes. And
Yeah.
thank you for sharing that. I mean, that's so important when we're talking about developing the therapeutic relationship, because we have to, Sandy, if we were working with you as a client, we would have to understand all of these perspectives that you have and how they overlap and are at play with what you are feeling and sharing in session. Is it that you are thinking about your time as active duty, and is that causing some worry now when you're thinking of other things? Or, you know, there's just so many ways that we would want to make sure that if we were working with you, we were paying attention to your perspective and experience, and using that to better support you moving forward. We do want to move on to discussion. So this again is like where we want to focus our conversation. We've presented a pretty big overview of barriers, challenges, not only at the client level, but the counselor level. And so throwing this question at you, how can we as counselors better serve military spouses? Again, even though we've sort of geared this towards reintegration and maybe life after service, as active duty or as the veteran status, how do you think we could better serve military spouses? How can we make sure that they're not getting lost out there?
Can I say something?
Sure, Sandy.
Okay, so you mentioned it a lot earlier. The spouse in all of this transitioning, or the family, it's really the family. The service member makes the decision to enlist, and when they or go officer, whatever the case is, but they make the decision to do that. When they do that, that decision affects the family, and they feel out of control. Because I work with a lot of there are individuals that are in the process of joining. They're not quite, finished everything. And we have to have a sit down conversation with the family and let them know, like, hey, your loved one's decision affects you, and make sure both parties are well aware of what that effect means for the relationship. And I think if we could, elaborate on that more and validate the spouse and the family members' concerns, that goes a long way. Just being heard and understood, because it almost feels like information doesn't come down to them in the same way it would come down to the service member.
Yes, I would agree with that 100%. And I love that you are talking to families prior to joining. I've often thought, you know, they have these transition out programs, which you hear good and bad. It's a different experience for everyone. Sometimes it's a really strong transition out program. Other times people say that they get packets and they just read through it and it's information that they don't really retain. But I've always wondered, like, why don't we have something in the very beginning that gives you that foundational knowledge? Like, here's a class on that you can attend on basics of military culture, which would include what to expect in military life, resources, things like that. You're right in that when we were talking a little bit earlier about that awareness and access of resources, they exist, but they don't necessarily, spouses don't necessarily know that they do. So advertising needs to be better. Communication across, you know, even from the service member to the spouse, if they're getting these resources, needs to be better. But even just opening the spouse up and saying, like, we know that you're important too. We want to talk to you directly, rather than it always being sort of funneled down through the service member. Sandy, you're saying Sandbox is a great resource as well as Military One Source. Yes, Military One Source. I recommend a lot of my students, I recommend that they go to that website because it's got a little bit of everything there. If you want to learn about how to buy a house, that's on there. If you want to learn about emotional consequences of deployment and family living, that's also on there. So yes, those are, thank you for sharing those resources.
Yeah.
Other ideas on how to better serve military spouses. So yes, catching them early, starting programs to potentially do that, or maybe even support groups. Like, here's a support group for new spouses. Kyra, putting you on the spot, what would be one thing that would be beneficial or helpful to you as a military spouse?
I feel like support groups, and since, you know, technology has become such a big impact, if there were just something as simple as a support group online that you could attend, you know, maybe those other military spouses aren't necessarily in your area, but you could still connect with them. I feel like that would be really beneficial.
Great. So not just saying each unit or squadron should have a support or a support group, but perhaps we offer them large and wide, and you can learn from the different experiences in other places. It's great.
Yeah.
I also like too that you had mentioned virtual. So we are definitely moving more virtual with COVID. It's been almost like a forced shift. So telemental health has grown astronomically. And so one of the things that I was thinking here, and it also ties into what you were saying, Kyra, is how can we better serve via telemental health? So are there ways that we can, I know Give an Hour is an organization where you can work with the military. You can donate an hour of your time as a clinician and work with a military spouse, but knowing that they are all over and perhaps it's in their region that they are lacking services. So usually with licensure, it's hard to be seeing individuals outside of your state, but you know, maybe using Pennsylvania as an example, I lived in Center County, and so there were a lot more resources in terms of mental health. Now I live in Lycoming County, which is a lot more rural, and we're seeing a lot more issues with wait times and services that are being specific or geared towards the military. I'd say in PA as a whole, that's true, just because it doesn't feel like there's a heavy military presence like there would be in Virginia and North Carolina. But I always think of telemental health. How can we get out there and do more to access this group? Is it using social media to advertise services? Is it reaching out to military organizations and saying, I'm here if you want to use me as a referral source? So one of the things I've learned from the Department of Defense is that they've tried quickly to move to telemental health, and there's a lot of issues with technology being available. And so what does that mean for us as counselors? If you don't have the video equipment to provide telemental health services, what is that doing for your clients? If you're working with a military spouse and you can't see them, how are you assessing them? How are you meeting their needs? How are you building rapport? So there are some counselors out there that say, I really, really struggle ethically. Like, I want to be providing services. I want to be working with this individual, but am I doing a great job or enough if all I can do is talk to them and not see them? They can't see me.
Yeah, we're really missing all those like nonverbals.
So moving on a little bit, what are innovative and creative strategies to address the barriers that exist for military spouses? Monica, this is where I was really excited that you were here from a creative strategy approach, that you were really using art therapy. Do you have any experience working specifically with military spouses, or in what you're doing, what could be a good idea or a good way of bringing military spouses into that space?
Currently, I'm not working with military spouses, but what I, quite often in my clinical practice, when I work with couples and individuals, I often do a kind of a reflective piece of, like if they're not if they're deployed, but if they're not in the picture, like they're separated from their spouse or whatever, I ask them to go back with an image or a feeling of, what it felt like when they were, first with this partner, and creating kind of a narrative approach to that. And it often brings back a connection that helps to keep them moving forward. So that, just thinking on the spot, that's one of the things that I like to do. I always try to bring in the five senses and as part of the grounding as well. So I don't know if that's helpful, but that's, immediately where I was going to with my thoughts. If you can't, if you can only do it over the phone and not with a visual. Also added to that, I have kind of created a quick assessment where I call it the Fast Five, and I tie it to our hand, and I do a quick check-in on associated with each finger. And the pinky is over the course of the past week, how was our food intake? And then the ring finger is over the past week, how was your water intake? And then middle finger, how was the past week with your sleep schedule? And then it gives us time to process each one of them. And then the last one is your thumb, and that uniqueness to ourself and how we tie it to ourself, and what mindfulness practices are you using. And so when I go through those five things, it not only holds them accountable to having me hear them, so that when I check in again, I'll ask, so, how did it go going to sleep an hour earlier without technology? And how did it go with increasing snacks during the day, or decreasing, fast food, or, so it's a great way to do an assessment and a follow-up each session. And then I close the session with a reflective piece, check in, what was their takeaway today? And then I always end with, and what are you going to do for self-care? And really have them think about themselves and what they need in that moment, that they can execute within the next 4 to 6 hours, depending upon what time our session was. So hope that's helpful.
Yeah, and so visual too, like using your hand. So it's something like I always do the 5 senses with clients because it's easy for them to remember, like 5, 4, 3, 2, 1, like 5 things I see, 4 things I hear. And it's a way that they can easily remember, like you're saying, what is my water intake? How am I sleeping? It's like a quick check-in that gives them also sort of that tactile, like I'm using my fingers to keep track of that. I also like that you are incorporating other types of interventions like mindfulness. That would be something that, depending on the person, could be very beneficial or something different to try that perhaps they haven't thought of. In the very beginning, you had talked about taking couples back. And so that made me think of a technique that I've used with more so spouses. I haven't worked a lot with couples, but doing different scrapbooks. So depending on where they're at in their military journey, if they're active duty, it's almost like a way of journaling and reflecting and having pictures as memories. So it combines a lot of creative strategies out there, but from however they decide to do it, week to week, day to day, keeping track of like, this is what I did today, this is how I was feeling, this is how I was feeling about my relationship. So it's kind of like that living journal over time. It's really beneficial when service members are in that, or couples are separated because of military service. So the spouse can choose to do something that will be shared when the service member comes back. So it's that living timeline of when they were gone, or it can just be something that they use to process things and remember things, because there's that struggle too of, you know, I'm just constantly struggling as a military spouse, and having them have that living diary or scrapbook, they can go back to the days that were good. They can go back to things that they've tried that worked well. They can realize, you know, I'm happy when I'm reading, or I'm happy when I'm exercising, or I can do this. I had a really great day last week. And then it's that back and forth of, you know, when you were feeling upset, you know, why were you feeling that way? What did you do? What worked? What didn't work? So that's just one innovative or creative strategy that I found very beneficial. Again, not only for them to be able to share if they want to, so that they can say, you know, this is how I was doing when you were gone. I've noticed that in the beginning it was really difficult. In the middle, it got a little bit better. And then in the end, I was anxious that you were coming home. So it's that process too. Or if they're experiencing maybe a separation for training and then getting ready for a deployment, that's something that they can work through as well. Like, what was I doing to overcome the stress of being alone during the first time period? And now what can I do to support myself this next time around? Any other thoughts? Those who are out in the audience, any other different strategies that you're using? It doesn't even have to be with the military. Maybe you're working with kids and you're thinking, well, this is something that I do that could be applied to military spouses, or we could give them to help maybe with their children. Very quiet out there.
I know with children and just kind of the reintegration process of a service member, coming home, those roles kind of change within the household, right? So even the spouse's, day-to-day routine is going to dramatically change. So I know one thing too that research has shown that service members kind of have trouble, especially if there is a mental health diagnosis like PTSD or something like that, engaging with their children because it seems so foreign to them. So really looking on ways to focus on how to have them interact, whether that's play therapy, family counseling, things like that.
Yeah, so one other creative strategy that I've seen used well is like nature-based therapies.
Mhm.
So families, to your point, Kyra, I've had one veteran that I worked with probably most recently. He was diagnosed with everything under the sun, and he came to counseling, and I was reviewing his history and why he was there. And he told me, I was diagnosed with PTSD, I was diagnosed with anxiety, I was diagnosed with depression, I was diagnosed with bipolar, I was diagnosed with borderline. And I'm like, wow, like what was that like to experience all of those diagnoses? And so we processed that, and we were talking about goals, and I'm like, so from what I'm hearing from you, are you here because you want to reduce some anxiety in your life, or you want to like trying to put the pieces together? And he goes very clearly, I want to learn how to have better relationships with my children. That was his goal. And he talked about how he was deployed when both of them were born. And, for the first 18 years of his son's life, he wasn't there. And his younger son, he feels like he has a better relationship because of the timing that his son was when his son came. So that really shows there's different goals that individuals have. The same for military spouses. We could be really focused on them in their military spouse role, and perhaps their goal is to help with, career identity. And so we need to follow them with that. But another creative strategy when working with the family, again, to renegotiate roles and understand how everyone's feeling uniquely, is through what I've done is like growing a garden. So individuals can pick a plant, like they can do a family garden, they can pick a plant that represents them. And then as a family, they grow that garden, and they discuss why they picked the plant, what that means in terms of their identity in the family, where they've placed, it's kind of like play therapy too, where they've placed the plant in their garden. How is their plant doing? How are they monitoring it? How is it growing? And so for children, sometimes it's very clear who feels disconnected from the family based on the plant that they pick, where they decide to plant their plant. Is it right beside mom? Is it off to the side on its own? And then again, what helping them process, why did you choose to do that? Well, I don't feel like I belong. And the same thing could be for the spouse or the service member. So military spouses who say, for the last 20 years, I've been the primary person that this family has relied on. And so now you're back. I've established all of this independence and my own identity of running a household, and I'm just not sure where you fit in with us. But the same thing the service member could be feeling is, I'm not sure how I fit in with you. So it's really working together in a creative way to build connection and understand the different roles and identities that currently exist. I am mindful of the time. It looks like we've got 1 minute. They were supposed to send a poll out. I don't know what happened to our room monitor, but are there any? Oh, my question was the poll. Okay. Any questions, comments, concerns? I know we've only got 1 minute. We really appreciate you being here and sharing all that you have, but